welcome to my YouTube video channel. For those of us that have already subscribed, I said a very big thank you to you. For those people that have not done so, I implore us to go and subscribe in order to give your support and encouragement. And I'm also saying a very big thank you to you in advance. Today I'll be talking about a very important topic. I'll be talking about tetanus infection, how you can prevent yourself, family members, and loved ones from tetanus infection. Tetanus is a very serious infection when it occurs, but it's also preventable. And it's more advisable to lean towards preventive culture rather than curative. Prevention is better than cure, and it's also economical. I will be discussing about tetanus infections, signs and symptoms, and the causes, preventive measure for tetanus infection. What is tetanus infection? Tetanus is a bacterial infection which is caused by Clostridium tetani, and it mostly affects the brain, muscle, and the nervous system. What is now the causes of tetanus infection? The causes of tetanus infection are the following. Number 1, bones injury. Bones injury leads to discontinuity of the skin layer of the body, which predispose individual to invasion of microorganisms. Another cause of tetanus infection is punctured injury. Punctured wound. Injury caused by puncturing objects such as needle and nail. Most of the time, people that come down with tetanus infection most of the time give an history of unknowingly stepping on a rust nail. And in children who cannot actually give account of how they come down with an infection, the nurse may notice pus coming out of the baby or children hair drum because of a punctured object. Maybe when they are pricking their head, they accidentally rupture their head drum. This can be a medium of tetanus infection to the children. Tetanus infection can also occur as a result of unclean surgical sites. Tetanus infection can occur as a result of cross injury. Tetanus can also occur in the newborn. This is neonatal tetanus, which is as a result of unclean umbilical cord. This is the communication between the baby internal organs and the external environment. If it's not being taken care of, it can lead to a source of infection to the newborn. Maternal tetanus can also occur because during the nursing period after the delivery of the baby, within six weeks following the delivery of the baby, their reproductive organs must not go back to their pre-pregnancy states. This can be a source of infection to the newly delivered mother if they did not maintain a septic technique and prevent infection as much as possible. I've mentioned the causes of tetanus infection. What are the symptoms that an individual can experience if they come down with tetanus infection? There may be history of recurrent headache because of the irritation of the toxin released by Clostridium tetani to the brain. Hypothermia is also a sign of tetanus infection. It's not every time that an individual has hypothermia, that is high body temperature. It does not mean that every time that individual have high temperature, that it means that the person is having tetanus infection. It may be a sign of another infection entirely. The cardinal signs of tetanus infection are trismus, that is tightening closely or the muscles of the mouth. Spasm is other cardinal signs of tetanus infection. Spasm may be localized one or generalized one. When there is spasm, it may affect the vital organs of the body, such as respirative organs. There may be cessation of respiration, that is breathing, when a victim of tetanus infection is having spasm. Tetanus is also a cardinal sign of tetanus infection. This is the position the individual has on when they make attempt to lie flat on their back. They will not be able to lie flat on their back. It's only the back of their head and the heel, back of their heel, that will be touching the surface they attempt to lie on, and it gives a characterized shape, U shape or cuff shape, because the remaining parts of the back will be arched upward. This is the cardinal signs of tetanus infection. I've mentioned the causes and the signs and symptoms of tetanus infection. Let me now move to the preventive measure, and the main reason I'm doing this talk. The preventive measure will now be in two aspects: the hygienic parts and the vaccination parts. For the hygienic parts, starting from the newborn, mothers should adhere strictly to the headstock that's been taught during antenatal. And these are some of the talks that they do give in antenatal. Please make sure you are trained to all those health talk. Do not tuck in the baby umbilical cord in their diaper. Don't tuck it in. Don't use hot fermentation on baby umbilical cord. Don't pull on the cord, it will fall on its own. Always endeavor to clean the umbilical cord as much as possible in a day. Clean it with methylated spirit and cotton wool, and other recommended gel can be used. And if a mother observes that unpleasant odor or pus is coming out of the baby umbilical cord, orifice of the umbilical cord, you should endeavor to visit the hospital to let those people that know about it to inspect the baby umbilical cord. Is so important. And for the mother, newly delivered mother, after the delivery of the baby, within 6 weeks, you should endeavor to maintain a personal hygiene. It's not only during that period, it's every time that the woman needs to take care of themselves and maintain a personal hygiene, because the reproductive organs does not go back to their pre-pregnancy state. It may be a source of infection to the newly delivered mother. So maintain a personal hygiene and adhere to every health talk that has been given to you during antenatal. Don't overlook it. Another thing is that every wound must be covered. Don't expose your wound. And whenever you have a wound, step on a punctured object. Seek care. Don't overlook it, so that it will not lead to a very serious problem at the long run. And if an individual that does not have up-to-date vaccine record have an injury whatsoever, visit a facility and make sure you take tetanus toxoid vaccine. Those are the first part of the preventive measure. Moving on to the prevention of tetanus infection through vaccination. There are recommended dose vaccine for prevention of tetanus and some other communicable diseases and infection. The recommended dose, the routine immunization schedule for children in prevention of tetanus is in combination of other vaccine. DPT is a vaccine against diphtheria, pertussis, and tetanus in newborn. The newborn will have their first dose of DPT vaccine at 6 weeks of life. The second dose will be given at 10 weeks of life, and the third dose will be given at 14 weeks of life. Those are for the baby. Now, moving on to the adult immunization schedule, routine immunization schedule for adults now against tetanus infection. For adults, the first dose will be given after the first dose. The second dose will be given 4 weeks after the first dose, and the third dose of the vaccine will be given after 6 months of the second dose. The fourth dose will follow after a year of the third dose, and the fifth dose will be given after a year of the fourth dose, making 5 doses of tetanus toxoid vaccine for adults. And to confer an appropriate immunity to an adult, every adult that have up-to-date vaccination should also have a booster dose every 10 years to have a conferred immunity against tetanus infection. And it's always compulsory for pregnant women to have 2 doses of tetanus toxoid vaccine before the delivery of their baby. But for us that have already learned about the 5 doses, the recommended doses against tetanus infection, even as a pregnant woman, if you have your 2 doses during pregnancy, you still continue to complete the recommended dose of the vaccine after the delivery of the baby, so that you can have a confer immunity instead of having to jab in every pregnancy. So that is that. Another thing is that if an individual sustains a crush injury and the individual does not have an up-to-date record of vaccination against tetanus infection, the individual is going to be given ATS and TT, that is anti-tetanus cell serum injection, and tetanus toxoid. And tetanus serum injection is a short-acting one, which prevents the individual from tetanus infection likewise. But before giving ATS, there's going to be a test dose that is going to be given. So they are going to observe the site of the test dose for any reaction, sensitivities, reaction to it, if the individual is fit for the ATS or not. And tetanus injection vaccine will also be given concurrently to prevent tetanus infection. Tetanus infection is preventable. Let's be combat ready to prevent every preventable disease in order to take charge and control of our health. Have come to the end of the video. Kindly like the video, share the video, subscribe, make your comments. Until next time, I'm doing another another video. Take care of your health and bye for now.